We know, of course, that 2 cases of the Omicron variant have now been detected here in the UK, one in Nottingham and one in Essex in the town of Brentwood. Well, on Friday, the government banned direct flights from 6 African countries where the new variant seemed more prevalent, placing them all on the red list.
Travellers arriving from destinations including South Africa and Botswana were told to quarantine at home for 10 days and take NHS PCR tests on day 2 and day 8. It's only from today when arrivals will have to quarantine for 10 days in a government-approved hotel facility. And as we were hearing last night, this comes alongside the reintroduction of mandatory face coverings in certain settings. But is this justified considering that the variant has limited medical data attached to it?
Well, public health expert Dr. Om Prasad Gautam joins us now. A very good morning to you, Dr. Om. The Prime Minister in his press conference last night described these measures as targeted and proportionate. Do you agree with that?
Thank you very much. Good morning, everyone. So, very good question. I think the Prime Minister has outlined very clearly that these are a targeted intervention at the moment because the new variant of concern B11529, which is also known as Omicron, has only declared as a new variant of concern by WHO, and it is also has a large number of mutations and has early evidence suggest an increased risk of infection. So, therefore, I think it is a matter of concern to everyone. While the government need to act effectively and immediately, I think that the Prime Minister outlined very clear strategy at the moment. And then while more data is still on its way.
Dr. Om, good morning to you. We're being told this is a variant of concern that is potentially more infectious. And we heard from Boris Johnson last night some measures that are being put into place. So obviously, we've got the 10 countries on the red travel list. We're also going to have PCR testing for people arriving in the UK, masks in some settings, and looking into booster jab rollout for more people. Would you say the government's gone far enough based on what we know?
I think the two things I would like to mention here. I think UK government is leading its way in terms of managing the COVID variant since the beginning. I think UK government can actually do 4 things at this moment. One is limiting the number of cases entering into the country. Prime Minister has already mentioned, and also I think the few countries have the travel restrictions have already been imposed for few countries. Second, the country can actually lead the spread of the new variant within the country. So this means early detection, tracking, tracing, and containing the virus. I think you already can see the 2 cases has already been detected, and then the tracing has already been started mentioning it. The third, Prime Minister has also outlined and also mentioned that everyone should be boosted jab. Everyone should be vaccinated. I think the vaccination rollout is going on well. It has to be ramp up. And then also the some of the public health interventions, so hygiene behavior change intervention measure has to be reimposed and reintroduced. Wearing mask in public places, washing hands with soap, and limiting the crowd. I think that's where I think more has to be done at this particular moment. And then finally, also this variant is also a concern to everyone, right? Not only in UK but other countries as well. As much as possible, there is a role for UK government to also support for other countries in terms of medicine supply, as well as for the vaccine supply, as well as for supporting the preventive measures.
Now, obviously, from a public health perspective, the government's acted swiftly and is being responsible. But there will be many GBNews viewers watching this who think even these measures have significant implications on things like the aviation industry, on people's ability to be together at Christmas, which, has effects on mental health, wearing things like face masks again. Libertarians believe it's an imposition on their civil liberties. All of these things have to be weighed very, very carefully. And yet there doesn't seem to be any evidence yet, at least from Southern Africa, that there are any severe symptoms linked to this new variant. So the next 3 weeks, the government will really have to demonstrate that these measures that they're bringing in are proportionate, won't they?
Absolutely critical. I think we only have the early data from South Africa and also from the WHO, and though this variant has a large number of mutation and some of them are actually concerning, the early evidence suggests that there is a small risk in reinfection, but it will take, as you said, at least few weeks to understand the impact of this new variant, such as how infectious this is and how severe is, how fatal this variant is going to be. So no data available at the moment to conclude whether vaccines reduce any vaccine efficiency. So I think we need to wait at least for a few weeks, at least 2 weeks, to make the real conclusion. But I think as a country, the precautionary measure has to be imposed so that at least we don't regret. We all have a role to play here, and then we need to also celebrate the forthcoming Christmas and others. So therefore, the government need to act swiftly, and which is something that government has started doing.
Yeah, Dr. Om, as we're saying, the government has reacted very swiftly to this. There's already 10 countries on the red travel list. Does closing borders and banning flights from other countries actually work, in your opinion? And if so, I mean, how can it possibly be policed? At the height of summer, 1.4 million arrivals arrive in the UK per month. And if every single one of those needs to have a PCR test, that's really difficult to police, isn't it?
Yes, we know that in order to reduce the spread of this virus and within the country and around the globe, it is important that the comprehensive measures are in place, including limiting the cross-border transmission. So banning flights might limit the case entering into the country, but it should not be seen as an absolute measure, as you also said. For any countries, it is important that their health system has a robust case detection, isolation, tracking, tracing, and case handling and treating system, which UK government has, and it has to be thoroughly in place. And the vaccination program should be scaled. Ideally, all need to be vaccinated, 100% people. And then the people also need to practice and adhere the behavior. By then, I think what needs to happen is this measures has to go together rather than only banning the flight. And also, I think what the people need to do. I think anyone arriving in this country, as government said, the PCR test after arrival, and these measures will actually protect everyone, and everyone has the role to play here. And we have seen in early COVID era, when these measures were not in place, there is a huge spread in communal transmission of these variants. And now, since government know the tactics how this virus can be suppressed, I think these are the effective measures which all need to be adhered, so that we can protect ourselves, our family, and the nation.